Thank all for coming here today. And I have sent out a few flyers to you guys. So if you're interested in any of our programs, you can reach out to me or Robert. And if you have any questions to OT, please ask Nicole. So Nicole is our occupational therapist. She's very experienced. She also served the school district supporting IEPs. So if you want to know any information for OT, please ask her. And we will also start our handwriting group class as well as the parent supporting group class. So she will introduce them as well in her speech. So please keep an eye on it. Okay, thank you. Let's welcome Nicole.
Hi, thank you. Okay, welcome to today's seminar. Cogleap is introducing occupational therapy services for the first time. And a little bit about me. I've been pediatric OT for 5 years. I have experience in behavioral health, specifically ABA, and sensory health. And the populations that I've worked with, most of my population is autism, followed by ADHD, as well as developmental delays. Some of my hobbies that I'm doing right now: strength training, rock climbing, cooking, just engaging in the outdoors, participating in the things that I love. And the topics we're going to talk today is: what is occupational therapy? What is the difference between medical versus non-medical OT? The differences between HFS and ABA, because some of us are enrolled in one or both. And then individual sessions versus the group classes that we're going to offer. So what is OT? To summarize, OT is really, we help children build like everyday skills that participate in their occupations, that help them grow, learn, and be independent. Occupations, what is an occupation? It's in our title. It's just activities that children do every day that brings meaning and purpose for them. So as young children, they play. That is their main role. They socialize, they engage in self-care, they take care of themselves. So we use that in whatever occupations they have and participate, and we teach them. And the settings of OT, we see it in the medical field, medical setting, the clinic, hospitals, rehab centers. And in the medical setting, we focus on improving their fine and gross motor, their visual motor for self-care. Maybe it's dressing, grooming, self-feeding, using utensils. And it's for children maybe with medical or developmental challenges. So maybe they're a little bit delayed and we want to catch them. We might address sensory challenges such as environmental distractions. Maybe they have a really hard time adapting to the environment, so they avoid the task. They can't participate. It really affects their attention and participation. We also want to address the oral, motor, and sensory challenges for picky eaters and problem feeders. We see that some of our diverse, neurodiverse population, they struggle with picky eating, very high. Maybe it's sensory, maybe it's something with the oral motor, difficulties chewing, difficulties with the muscles in their mouth, so they avoid certain foods. And we support recovery after medical treatment, so maybe regain the strength, coordination, or the function. In a non-medical setting, such as educational, the school, they focus on school readiness and learning. So handwriting, visual motor, perceptual, attention, classroom participation. It's different because if the child, whatever the child is struggling in the school, the OT can help with that. If it affects their academics and education. So if it doesn't, they're going to ask that the clinical OT takes care of it because they can't address it in the school. That's why some of our kids have school OTs and some of them have medical OTs. So we offer here ABA, And you want to know what this difference, like why do I need both? ABA and OT are fundamentally different, but we complement each other. So the focus of ABA is we teach and reinforce very specific behaviors that really increase positive skills and decrease maladaptive behaviors. So behaviors that maybe they have a really hard time with, and it's hard for them to adjust. But with OT, we support children, like I said, in their occupations. So play, learning, self-care, social participation. The approach for ABA is different. They use principles of like reinforcement, maybe positive praise, token system, prompting, a lot of data collection to kind of shape and understand the behavior. But with OT, it's developmental. So we assess the milestones, we look at their skills. For instance, when a child, in their first year, we assess, okay, they don't just go straight to walking and running. They sit up first, and then they maybe crawl, and then they stand, and then they walk. So we really assess their skills, and we build on that. We look at the strength, the challenges, the environment, and then the activity to help the child. So in ABA, they address communication, using words, maybe a device. If the child maybe has difficulties producing verbal speech, maybe they're nonverbal, teaching gestures. ABA teaches social behaviors, eye contact, turn taking, sharing. ABA does functional behaviors like requesting and following directions. And they might reduce some of the challenging behaviors like tantrums, aggression, or like inappropriate social behaviors. But with OT, we look more at the fine and gross motor skills, sensory processing, self-regulation, the visual motor skills. Maybe the visual motor could be like hand-eye coordination, handwriting, daily living skills, feeding, hygiene, just more of that independence. And we also look at the social interaction and play. So like I said, both really, we work together and we complement the child. Any questions on the differences? ABA, OT?
I think it is just overlapping.
Yeah, it does overlap. We just address it in a different way, a different approach. Does anyone here is their child enrolled in ABA or previously enrolled in ABA?
Previously.
Okay, yeah. So how is OT different than HFS? So here at Cogleap, we have a system, and this system is very unique. This is my first time encountering the system here. I haven't seen it up in the clinics or areas that I've worked. It's very unique, but it encourages like brain-body integration through structured movement. You'll see us do exercises like balancing on one leg, fine and gross motor activities, coordinations, strengthening. It's very unique. It's like a certain exercise and steps, and as the child gets better, the task gets harder and harder. And it really supports focus and listening with that rhythmic, calming sound frequencies and specially engineered music. So they wear these headphones. It's bone conduction. So typically with headphones, you put it into your ear, but with HFS, it's like over your ear, so you can still hear directions from the instructor. Yeah, it's very, very unique. And it really works on strengthening working memory, impulse control, and working on mindfulness and emotional regulation. It is very, very unique. So what is the difference? So in HFS, we see the structured movements. We might ask the child, okay, take your arms, move it this way, this way, this way. Let's do it 10 times. It's like an exercise, like multiple reps. But in OT, after you practice doing this movement and it's very fluid and it gets really good, how do we functionally use it in real life? OT looks at, okay, when do you ever need to cross your body's midline? We go teeth brushing. We have to have the child learn to brush their teeth, and we have to get them over this side. We don't really switch hands when we brush our teeth. We don't really go like this. We just cross, combing our hair, passing objects across the body. So we look at functional tasks in everyday life. HFS, balance on one foot. How long can you balance for? 10 seconds, 15 seconds. Okay. In OT, why is that relevant? Why is that important? When maybe we're putting on pants, the child has to learn to balance on their one foot, right? We typically don't really sit down to do it. We stand up. And teaching balancing is really helpful in OT. Kicking a ball towards a target, that is something that OTs work towards. And then in HFS, I see a lot of like hand mobility or dexterity. Okay, why is that important? In OT, writing. We need to practice hand strengthening, coordination, because it's important for writing, buttoning clothes, picking up utensils, self-feeding. There's a lot of tasks that requires your hands, and HFS takes those structured movements, practices it, you get it down, and then in OT, we do it into functional activities. So we really integrate the movements. Any question on the difference? Yeah, does that make sense?
Yeah.
Yeah. So we're really looking for activities for the child in real time. Okay, so here we want to introduce one-on-one OT services, and it's new to Cogleap, but it's individualized one-on-one sessions with the child, and at the moment it is in clinic only. We work with caregivers to develop goals that are really meaningful to the family and child. We want to work on goals that are important, something that is relevant to the family's goals, and so that the progress is like important. And the sessions are about 50 minutes direct. Their activities are fun, engaging, and working on the specific needs. Because we only have about 1 hour with the child, every session is really important. We target the goals every session. The current steps of services to getting OT services at the moment is we do about 3 to 4 hour initial evaluation. We do this because we want to assess their baseline skills. We want to know where they're at, right? Their levels. We do the parent interview because I want to know what's important to you, what's important to the child, what they like. And then we do the observations. So in total, 3 to 4 hours. And after that, we determine the level of service for OT. So how many sessions a week, what that might look like, the intensity. Any questions on one-on-one? Yes.
Do you also do OT in group settings ever?
There are, which I'll segue into. All right, so at this moment in time, maybe in the future, we'll offer group children classes, but at the moment, we will be offering group parent education classes. So the theory behind this is we do services with the child. It's maybe an hour a week, 2 times a week, but at the end of the day, the child goes home. They spend so much time in the home, the school, the community. So it's really important for the parents to learn the skills so that it can kind of bridge that gap. And we want to offer these classes in person. The first one we want to offer is called A Sensory Approach to Regulation. There's a very high prevalence of sensory processing difficulties in children with neurodiversity. And it varies. It could be like textures, sounds, whatever it is, it seems to be really hard for them to participate due to the sensory difficulties. But in this class, which is, this class will support your child's sensory regulation in everyday life, which you'll be learning like strategies to recognize their sensory needs, create calming routines, provide the right sensory input for focus and comfort, And they build skills for smoother transitions, improved attention, just greater overall confidence in the home, school, and the community. And this course is about 5 weeks long. It's one time per week. Every week is a different topic. And each course is about 1 hour. The second parent education class that I want to introduce is Introduction to Picky Eaters, because there's a lot of picky eaters in neurodiverse children. And that is one we want to introduce these strategies for supporting children who are picky eaters by understanding, like, is it sensory? Is it motor? Is it emotional? What is it that's making it so hard for them to just eat? And we just want to teach simple, positive approaches to mealtime, ways to expand food choices without pressure, and just tools to make eating a more enjoyable experiences for the whole family, because it can be very stressful if your child doesn't eat. It's very stressful. And we want to help parents with that. And that is also a 5-week course. Every week is a new topic for about 1 hour. We also want to introduce handwriting group classes. These will help build foundational skills needed for writing success through playful, hands-on activities. We'll focus on fine motor, pencil grasp, pre-writing strokes, visual motor coordination, and attention. It's all fun. It can be social because it's a group. We're thinking about groups of 3 to 4 kids. There are going to be 2 groups, 3 to 5 years old, because 3 to 5 years old, writing looks very different than someone who's 6 and over. 3 to 5 is more foundational, learning to hold that pencil or crayon, learning the basic skills. But once they get older, 6 and up, it becomes more refined. It's about like letter formation, writing their name, copying from a board. It changes. So that's why we split into 2 classes. Any questions on handwriting?
So the kids can write neater and more beautiful.
Yeah. So handwriting is,
He can write,
Yeah.
but it's not like a neat. And
Yeah,
of course
yeah.
not.
we
Not good.
yeah, I understand. We focus on writing. Writing is broken down into several different gradings. So it's like, can you write neat? Is it legible? How fast are they writing? Is it nice, but it takes them a minute to write a word? Is it too big? Is it too small? Is the spacing too large? Is it crunched together? So we look at different aspects of writing, and we try to, whatever they're struggling on, we're going to focus on that.
Is there any include for the coloring? Because he cannot color within the text.
Yeah,
His coloring is all over.
yeah, we definitely can. We absolutely can. If whatever it is that they're struggling with, a writing utensil, crayons, coloring, pens, whatever it is, copying from a board, sometimes that's hard. Maybe you can write your thoughts on paper, but the moment you copy on a board, like a teacher's writing something, you look up and you look down and you lose your place, or it's like messy because you have to do 2 things. You have to look up, look down, and it's really hard. So we can also do that.
I think this section is really good because in the public school, they don't teach you how to handwriting. And then like my son, he on the left left hand writing. So it's difficult for us to focus on him because we on the handwriting, right hand, right. Yeah. Because every time he rolls something up and down, nothing on the line
Okay.
or in the box. It's so difficult to read. Handwriting,
Yeah.
I think this one's really good.
Yeah, and every child they're different. So what are their needs? Handwriting is unique because when you look at it, you think, oh, it's poor handwriting. But we have to understand, why is it hard for them? Some kids, they have a hard time even holding the pen, or they hold it in a way that's it's not functional. Like they hold it and it's like maybe like this, and they're trying to write neatly, but that's not the most functional way to hold. There are better ways. So maybe we might help with that. Sometimes they can't even feel the pencil in their hand. I know that sounds, kind of crazy. Like, oh, what do you mean you can't feel the pencil? But sometimes they hold something and they can't, their strength, they just don't feel the pressures off. So sometimes they're writing and there's nothing coming out, but they think something's coming out. So they're different aspects, very unique.
So you have children with a bad handwriting, so you try correcting the right way.
Yeah, teach them the skills because we want to teach them so that he can understand, why is he struggling? What can I work on? Is it my vision? Is it my strength? Is it like, what is it? What's going on?
It is also 5 weeks, 1 hour per week.
This one is, I think we've said about,
Yeah, it's a continuing
Yeah.
service, like 1 hour for every week. So it's continuing until you feel that, kids
Yeah.
are okay.
I see.
yeah,
Okay, so it is starting with once a week.
yes,
Yes.
once a week and then ongoing until you feel like this is where I want my child to be and I'm comfortable with that. Okay, so any questions on the group classes?
So how many kids in one group class? Group class?
For handwriting,
Yes,
we are thinking about 3 to 4.
3.
And I want to keep it that size because I want to give as much attention to the child,
It is also 1 hour for
Yes.
4 kids.
1 hour. Yes.
What if one of the issues with handwriting is that is actually just the stamina? So they write for maybe 10 minutes and then they say their hand is tired.
Okay.
Is that something that can be practiced and improved upon through a class, or is it just a matter of doing it?
Yeah. So if it is stamina, it could be a fine motor, some fine motor challenges. So we might incorporate activities that work on stamina with the hands, hand strengthening, and then we might do some handwriting while in the course too. Because if the underlying factor is endurance, we have to focus on that. Because if we don't address that, then handwriting will be poor, right? We have to strengthen something before we get better at something else, right? Does that make sense? Yeah. And this is the opportunity to really incorporate different activities. It might be 5 to 10 minutes of hand strengthening, and then we jump into handwriting. Okay. So some of the questions you might have is, how is OT covered? So we are working on being credentialed with various insurances. And right now we accept private pay. So we're in the process. Hopefully that process will happen in the next couple months and we'll hear back more from the insurances. But right now we do accept private pay. Insurances often cover OT if they consider it medically necessary. Yeah, so because it's a medical service, right? Group classes, parent and handwriting group classes are currently private pay. So if you use insurance that cover OT and they deem it medically necessary, they want you to address certain things that they feel are medically necessary. With private pay, it's different because you're paying, so you get to pick and choose what you want your child to work on. So that is really the main difference. How do I know if my child would benefit from OT? So maybe there's delays in motor skills that affect their ability to participate in self-care. Like maybe they're, 10 years old and they're still having difficulties with dressing or buttoning clothes or holding utensils to eat. So we can definitely focus on that, focus on their motor skills. Picky eating, that's affecting health and family routines. You have a difficult time going out to eat because your child only wants to eat the 5 things they want to eat and they refuse to go out. And with food, you want your child ideally to consume, nutritious things across different food groups because they need the nutrition and the vitamins to kind of grow. So if they are stuck in like 5 to 10 items and that's all they eat, it's something to consider. Sensory processing difficulties that affect attention and emotions. We have children who are very sensitive to sounds, textures. They don't want to, maybe affects them socially. They can't be in a room with other kids. It's too loud. They can't touch certain textures, certain foods. In their emotions, maybe they lash out because they have sensory overload. They cry, they scream. It's really hard for them in the environment. Any questions about OT?
Yeah, I do want to add some information regarding the insurance coverage. So far, we have been accepted by Aetna. So if you hold that insurance, yeah, we can cover the service.
How about Tri-Care program? This is for military insurance.
Yeah, we are still in the process of,
Yeah, because I checked on their website, they say they cover for the ADA and the OT. So you should look at it.
Yeah. We're still under the process of approval for more insurance. And for handwriting and parent education, it's not covered by insurance. Yeah, even we are approved, it's not covered. It's for educational purpose, not for medical purpose.
Yeah, insurance, they have to see it as a medical necessity. They don't see handwriting as a medical necessity. The school, they may work on it. The OT there might work on it because it might affect them academically. Like it's hard if you have a hard time writing, it's going to affect you academically. So school takes care of that sometimes. Sometimes.
If you request, you don't request.
So sensory approach to regulation and picky eater sections are parent education.
Yes, parent education. And let me pass around the topics.
So for parent education, we have 2 series of classes. So we have 2 packages for different topics.
So let me share a screen that.
So for those section, the child doesn't need to be in the class.
Oh, what? Oh, yeah, just parent.
Just the parents.
Yes.
Oh, I see.
So it's in the morning,
Okay, got it.
Oh, sure.
So it is every Monday, 11 to 12.
Yes.
Okay. So I wanted to share on the screen the topics that will be in the group class. Just a little overview. Screen sharing is halting.
Are you already sharing a different screen?
Let's
Is that
see.
possibly what it is? Or
That might be it.
Oh, yeah.
Stop. Share. Okay, so here on the screen, let me zoom in. The topics. So the topics for the group parent training for sensory is week 1, we talk about the 8 sensory systems. So we are made up of several systems: taste, touch, smell. And I want to go over those systems with you because those are really important to understand. And it really helps us respond to the environment, understand and respond to the environment. Week 2, we talk about types of sensory patterns. We talk about, is your child a sensory seeker? They are avoiders. Are they sensitive? Do they not register to the environment? It's loud, it's chaotic, but maybe the child doesn't seem to notice what's going on around them. So we look at different types of patterns with their sensory system. Then we go on to week 3, which is sensory processing, how it really affects their ability to focus, move, learn. When sensory input is overwhelming or under responsive, how it can impact daily activities, emotional regulation, attention, and participation in their home, school, and community. The 4th week, we talk about a sensory diet. So sensory diet really is a list of activities that, very personalized plan of activities that the child can engage in the home or here at school, where it helps them stay focused. It's not necessarily food, we just call it a sensory diet. It's just basically a list of activities. And it's really, implemented and guided by an OT. And we help find what is appropriate for your child. And then the last session is we find regulation activities that help balance that sensory input, support emotional and behavioral control. Yeah, so we find different activities for them. So that's over a course of 5 weeks. For picky eating, actually it is 6 weeks. The first one is recognizing what is the difference between picky eaters and problem feeders. Picky eaters, typically, they might eat like 20 items, the same items. And then problem feeders is that they just eat a few items. It's really hard for them. There's something else going on. They're not really getting the nutrition. So there's a difference between picky eaters and problem feeders. Week 2, we talk about food, behaviors, and hormones. It's all tied together. It impacts appetite. Is this impacting your child? So that's week 2. Week 3, skills involved in eating. So eating is very complex. In our minds, we see eating as we just put food in our mouths, but it is physical, it's sensory, it's cognitive, it's social. There's a lot of things going on with feeding, and for a child who is involved, it's a lot for them. So we have to understand why. Week 4, sensory and mealtime. Talking about how sensory processing influences eating, textures, smells, tastes. And then week 5, the steps to eating. We're going to break it down, take it back to what they can tolerate, what they can't tolerate, and kind of see where do we begin. Week 6 is long because it's a lot of information. It's 1.5 hours. But we're going to talk about where to start, oral motor skills, sensory, and using language to promote eating, because language matters. What you say to the child, they absorb, they hear you. So we want to talk about that. So that is 6 weeks. And then the group handwriting courses, like I said, it was broken down into ages 3 to 5. They build foundational skills. We talk about fine motor and hand skills, developing hand strength, learning pre-writing strokes and shapes. That's when they're very young. Looking at sequencing, hand-eye coordination, posture. Are they sitting slumped over? What's going on? It's really hard to write if your head is on the table. Something about their posture, endurance. And then as they get older, fine motor, mature grasp, letter formation, legibility, endurance, spacing, organization, staying on the lines and margins. But yeah, that is really what's going to be covered in these parent courses and the kid handwriting, the group handwriting courses for kids. Any questions on that?
When you're born,